When I was a medical student, I did an attachment in a spinal hospital, and I found it absolutely fascinating. But I also had, at the same time, an academic interest in neurosciences. I did my thesis there. So going into neurosurgery seemed for me the best option to keep the spinal option alive as well. The most important thing for the patient to know is that we are here to help them for their best solution, not to do what might be technically feasible and what's the latest thing on the market, but to find the right solution for them. So a memorable case was a patient who presented when she was 24 weeks pregnant with a tumour pressing on her spinal cord in the upper cervical spine. And this was a very challenging situation, balancing the risk to the unborn with doing an operation to the risk clearly to her not being able to move either limbs or even survive. We couldn't operate on her in the front because of her pregnancy. There was a very challenging situation. I think this made us realize that you need to have a good team in order to manage these challenging situations. It's not just the surgeons, it's the whole team around it, from anaesthetist to an intensive care unit, to having all these specialties that are important to manage challenging situations. Needless to say, it was a very rewarding thing when the patient walked in 6 months later and to hear that the baby was well. But it's a situation like this that brings it home how important it is to have a good environment and a safe environment for challenging cases.